Kwa jina la Baba na la Mwana na la Roho Mtakatifu. Tunasoma katika Injili ya Marko sura ya 2 aya 17. Wenye afya hawahitaji tabibu, bali walio wagonjwa. Tuombe. Ya Mungu Baba Mwenyezi, tunakushukuru kwa zawadi ya miaka 50 ya kuanzishwa kwa Jumuiya ya Afya kanda za Mashariki, Kati na Kusini mwa Afrika. Mwenyezi Mungu, afya ni mtaji muhimu unaotupatia sisi wanadamu ili tuweze kukutumikia wewe na jamii kwa ujumla. Tunapoadhimisha miaka hii 50 ya jumuiya hii, tunakuomba uendelee kuwa nasi. Wabariki wale wote, watu na taasisi zote zinazojihusisha na masuala ya afya, ili watekeleze wajibu huu kwa uaminifu na uadilifu, ili watu wako wapate ustawi na afya njema, waweze kukutumikia wewe vema na kutumikia jamii kwa ujumla. Tunaomba hayo yote kwa njia ya Kristo Bwana wetu. Amina. Kwa jina la Baba na la Mwana na la Roho Mtakatifu. Amina.
Na tuombe. Mungu unayetusamehe maovu yetu yote na kutuponya magonjwa yetu yote, wewe Mungu unayetukomboa uhai wetu na kaburi, na kuomba utusamehe makosa mengi tuliyokutenda yanayotusababisha kuingia katika magonjwa na matatizo mbalimbali. Kwa mkono wako mwema, Mungu wetu, uwape hekima na uwezo viongozi wote wa mabara yetu na nchi yetu Tanzania, madaktari na wote wanaohusika na afya za watu wako, ili waweze kutumika vema kuleta uponyaji mkamilifu kwa watu wako. Tunakushukuru kwa ajili ya taasisi hii, taasisi zingine za afya. Uwape kunia mamoja, uwape nguvu za ubunifu, ili waweze kufanya utafiti sawasawa na mahitaji ya watu wako ya nyakati hizi. Tunakuomba Mungu, utufanye sote, wanao wakubwa kwa wadogo, kuwa waadilifu na kuishi maisha ya usafi na utii, tukiwa na hofu yako, ili utukuzwe katika maisha yetu. Mungu, tukuzwe katika taifa letu na katika bara letu la Afrika. Utusikie Baba, Mwana na Roho Mtakatifu. Amina.
Thank you very much. Dear guest of honor, Your Excellency, Dr. Philip Mpango, the Vice President, United Republic of Tanzania, Honorable Umi Mwalimu, Minister of Health, United Republic of Tanzania, Honorable Ministers from the ECSA-HC Community Member States, Honorable Emanuela Mtafikolo Kaganda, the Arusha District Commissioner and the representative of the Regional Commissioner for Arusha, Professor Joshua Mbulanina Dambisia, the Director General ECSA-HC Community, permanent and principal secretaries from ECSA member states, distinguished members of Directors Joint Consultative Committee, senior government officials from member states, religious leaders, collaborating and cooperating partners, members of the media, distinguished ladies and gentlemen, good morning. Habari za asubuhi. Jamhuri ya Muungano wa Tanzania. Jamhuri ya Muungano wa Tanzania. Unjani. It is with great honor and privilege to welcome you all to the ECSA-HC Community 50th anniversary celebration held here at the magnificent Grand Melia Hotel in Arusha, affectionately known as the Geneva of Africa. We are gathered in the heart of Tanzania, a land of renowned for its breathtaking Ngorongoro crater, the Mount Kilimanjaro, the vast plains of the Serengeti, and the stunning beauty of Zanzibar. Today, we thank our Almighty God as we have this historic moment to celebrate 50 years of leadership and excellency in regional health collaboration. But again, we are so grateful, ladies and gentlemen, to have Your Excellency, Dr. Philip Isdori Mpango, the Vice President of United Republic of Tanzania, as a guest of honor. We understand how busy you are with your tight schedule to assist our dearest President, Her Excellency Dr. Samia Suluhu, to build our lovely nation. We really appreciate your commitment to come and join us in this memorable and very important event. Thank you very much. To welcome him, ladies and gentlemen, a big round of applause to welcome the guest of honor. There will be the facilitator of this spectacular event. Your Excellency, the Vice President, please now allow me to welcome Dr. John Jingu, the Permanent Secretary, Ministry of Health, United Republic of Tanzania, for the introduction.
Your Excellency, Dr. Philip Isdori Mpango, the Vice President of the United Republic of Tanzania, Honorable Minister of Health for the United Republic of Tanzania, Honorable Umi Mwalimu, Honorable Ministers from the ECSA Health Community, Arusha District Commissioner, but today acting for the Regional Commissioner, Honorable Emanuela Mtafikolo Kaganda, Permanent and Principal Secretaries here present, Director General of the ECSA Health Community, Professor Yuaswa Dambisa, distinguished members of the Directors Joint Consultative Committee, senior government officials from member states, collaborating and cooperating partners, members of the media, distinguished ladies and gentlemen, habari za asubuhi. Good morning. It is with great pleasure that I take this opportunity to welcome you to this Golden Jubilee celebration for East, Central, and Southern Africa Health Community, known shortly or briefly as ECSA-HC. It is a moment to celebrate 5 decades of impactful collective efforts of ECSA Health Community in advancing quality health care in our region. The theme of this year's celebration, the Golden Jubilee celebration, is 50 years of leadership and excellence in regional health collaboration. Your Excellency, allow me now to introduce some of the distinguished participants in this year's event. With us, Your Excellency, we have our host, the Acting Regional Commissioner, Honorable Emanuela Kaganda. But we also have Honorable Umi Mwalimu, Minister of Health, the United Republic of Tanzania. We have Dr. Sultani Matendechero, representing Honorable Susanna Nakumicha, Cabinet Secretary for Health, Republic of Kenya. We also have Honorable Mduduzi Marsebula, Minister of Health, Kingdom of Eswatini. We have Honorable Halima Daudi, Deputy Minister of Health, Republic of Malawi. We have Honorable Anifa Kawoya Bangirana, Minister of Health, Republic of Uganda. We have with us Honorable Douglas Tendai Membo Shora, Minister of Health, Minister of Health, Republic of Zimbabwe. Then we have Ms. Saipati Monyombi, Deputy Principal Secretary and Head of Delegation, representing Honorable Selibe Mochorobane, Kingdom of Lesotho. We have Dr. Prithi Viraji Ramputi, Director, Health Services and Head of Delegation, representing Honorable Kailesh Kumar Singh, Jakutpara, Republic of Mauritius. We have with us members of the Directors Joint Consultative Committee, comprising Directors of Health, Chief Medical Officers, Directors of National Research Institutions and Departments, Deans of Faculties of Health and Presidents of ECSA Health constituencies, colleges, and the College of Health Sciences. We have researchers, we have scholars with us. We also with us collaborating partners, including WHO Afro, Africa CDC, Intergovernmental Authority of Development, IGAD, AMREF, FP 2030, Equinet, University of York, Nutritional International, Operational Smile. We also have East Central and Southern Africa Secretariat, ECSA Secretariat. Your Excellence, thank you for the opportunity. Sorry, it seems I've missed, and I'm sorry and I apologize. We have delegation from Zambia. Honorable Minister from Zambia. Oh, the PS, my colleague, yeah. And all the delegation from Zambia. Your Excellency, all these countries have a number of delegates here representing different constituencies. Thank you very much for this opportunity.
Thank you so much, Dr. Jingu. Another round of applause for him. Your Excellency, the Vice President, for now, allow me to welcome a bit of entertainment from Holela Band, led by Ellis, for 5 minutes entertainment.
na hiyo olela itakukosti wewe, na hiyo olela itakukosti wewe, na hiyo olela itakukosti wewe. Kutumia dawa bila kumwona daktari, uko ni kufungua ofisi za mikopo mochwali we, ugonjwa kukatisha dozi, ni sawa na kuchati na mama mkiwa umekula vyombo we, dari na homa zinafanana tabia, na si ukiumwa kichwa kadhani ni malaria, na hiyo olela itakukosti we, na hiyo olela itakukosti we, na hiyo olela itakukosti we, na hiyo olela itakukosti wewe. Mtoa huduma za afya, kugawa dawa bila kupata mwongozo, ni sawa na kuchati na mama ukiwa umekula vyombo we, dalili za homa zinafanana tabia, na si ukiumwa kichwa kadhani ni malaria, na hiyo olela itakukosti we, na hiyo olela itakukosti we, na hiyo olela itakukosti we, na hiyo olela itakukosti wewe. Ufugaji holela usiopata maelekezo ya wataalamu tutajipoteza, upo kubembea kwenye za umeme, hapa tabia za holela zitakukosti wewe. Tujali afya zetu, jali afya yako, ona ya mwingine, kwa maslahi taifa letu wewe. Itakukosti, 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 olela olela yu, olela olela yu, olela olela yu, olela olela yu, olela olela yu. Tusipojali afya yako, olela olela yu, usipojali afya yako, olela olela yu, usipojali afya zetu, na hiyo olela itakukosti we, na hiyo olela itakukosti we, na hiyo olela itakukosti we, na hiyo olela itakukosti we.
A big round of applause. Holela, holela means carelessness, to be careless. And their song is about those people who are careless about their taking care of their good health. For example, in a very specific way, Your Excellency, Vice President, they've been talking about those who are taking incomplete doses from as against what they are prescribed by the doctors. So they say it will cost you, even it will take your life away. This is a special campaign from the Ministry of Health to ensure that people are taking complete dose. Another round of applause for Holela Holela. So tell your friends, don't be Holela Holela. Yeah. Thank you very much. Your Excellency, the Vice President, may I now welcome Honorable Emanuela Kaganda, representing the Regional Commissioner, to give us the welcoming remarks.
Honorable Your Excellency, Dr. Philip Isdori Mpango, the Vice President of the United Republic of Tanzania, Honorable Umi Mwalimu, Minister for Health of the United Republic of Tanzania, Honorable Ministers from the ECSA health communities, distinguished members of the Directors Joint Consultative Committee, senior government officials from the member states, collaborating and cooperating partners, members of the media, good morning. A warm welcome to each one of you as we gather here to celebrate a momentous occasion, the Golden Jubilee of the East, Central, and Southern Africa Health Community. And on behalf of the Regional Commissioner for Arusha, Honorable Paul Christian Makonda, I feel honored and proud. I feel honored and proud that ECSA Health Community has home in our beautiful city of Arusha. Similarly to ECSA Health Community, the Arusha city 50 years ago was just fledgling community with the dreams as tall as skyscrapers of ours today. Through the decades, we have grown together, overcoming challenges, embracing opportunities that have shaped us into a vibrant city we are today. Honorable, Excellence, guest of honor, today, as we reflect on the journey taken by the ECSA health community, we should remember that the Golden Jubilee is not just about looking back, it is also about looking forward with hope and determination. As we celebrate our achievements, we must also renew our commitments to continue building, implementing healthcare and the city that is inclusive, innovative, and sustainable. A city where every resident has the opportunity to strive and contribute to our collective success. Your Excellence, guest of honor, the Arusha city is home to diplomatic organizations, and we always feel humbled and honored to be host to such critical institutions that aim to shape the future of Africa. It is my belief that the experts lives in Arusha now call this city second home, and with the growth of our city and its surroundings, we have thrived to create a conducive environment for the whole experts community. In the coming years, let us strive to strengthen the relation we have to ensure that we move in unison as we tackle the numerous socio-economic challenges we face. Today, as we recognize 50 years of growth and prosperity, let us also pledge to continue working together, united in our diversity, to ensure that the next 50 years are even brighter and more promising for generations to come. Your Excellence, guest of honor, please allow me now to invite all the delegates who are here today to spare some times after their meetings to visit our tourist attractions areas in our Arusha region, starting with Mount Meru, which is very near to this city, Arusha National Park, where our President, Dr. Samia Suluhu Hassan, Dr. Samia Hassan acted a movie on Amazing Tanzania. You can also get time to visit Ngorongoro Crater, Serengeti, and Tarangire, just to mention few. And on your spare time, please make yourself time to visit our restaurant so that you can taste the hospitality of Arusha people and also delicious cuisine. On your way home, don't forget to take Tanzania with you by getting some souvenirs from our courier shops. Honorable, Your Excellency, Guest of Honor, allow me now to thank once again all the delegates for being part of this special celebration, and I wish ECSA Health community many more years of prosperity, unity, and progress. Asante sana. Asante.
Thank you very much, Honorable Emanuela Kaganda, the District Commissioner of Arusha, representing the RC. Your Excellency, Vice President of the United Republic of Tanzania, allow me now to bring on the podium, Professor Joshua Dambesie, will give us the remarks by ECSA-HC. This is the Director General. Welcome.
Thank you very much. Your Excellency, Dr. Philip Isdori Mpango, the Vice President of the United Republic of Tanzania, the Honorable Umi Mwalimu, the Minister of Health of the United Republic of Tanzania, and our host this morning, the Honorable Ministers and heads of delegation from the ECSA member states, Honorable Emanuela Kaganda, acting for the Regional Commissioner, Arusha Region, permanent principal secretaries from member states, to single out the Secretary for Health from Malawi, who is the chair of the advisory committee of ECSA Health Community, Dr. Samson Ndolo, members of the Directors Joint Consultative Committee, senior government officials from other government departments from the United Republic of Tanzania, our collaborating and implementing partners, the media, invited guests, colleagues from the ECSA Health Community Secretariat, ladies and gentlemen, it gives me a great pleasure to add my word of welcome to you all as you join us to mark this milestone in the life of ECSA Health Community. Your Excellency, ECSA Health Community has its roots in the winds of change that swept across our region starting in the mid to late 1950s. And by the end of the 1960s, left in its wake many African nations independent. Our nations were committed to a number of ideals, including the unity of the African peoples wherever they are, including the spirit of self-reliance African socialism as espoused in the Arusha Declaration of 1967, and in some of the other countries, different ideologies guided this, but at the back of everything, as you are aware, Your Excellency, was the commitment to fight ignorance, disease, and poverty. By the late 1960s, our ministers realized that given the common health challenges the nascent countries faced, there was need to put heads together towards common solutions. And thus was born the regional meetings of the conference, the regional meetings of health ministers of the East Central Southern Africa region. And the first such meeting was held in 1972 in Lusaka, Zambia. And the next one was held in Gaborone, Botswana in 1973. And the 1973 meeting was quite pivotal in the establishment of the organization whose 50th anniversary we celebrate today, Your Excellency. It was at this meeting that the ministers decided that there should be a permanent mechanism established to ensure that the cooperation they were having informally was formalized. But even more important to our function today, it was at that meeting that the Honorable Ali Hassan Mwinyi, on behalf of the United Republic of Tanzania, offered to host such an organization in Arusha, and offered, or rather assured his fellow ministers that such an organization would have full diplomatic status. The ministers accepted the offer from Tanzania, and Tanzania has over the 50 years fulfilled its pledge to host as a diplomatic organization this secretariat. Immediately after the formation, the next meeting that was held in Nairobi, Kenya, the then Vice President, His Excellency Daniel Arap Moi, observed, among other things, that the decision to establish the organization was a desirable development towards coordinating the health efforts of the countries. Your Excellency, the organization whose 50th anniversary we celebrate today established its office on the 24th of August, 1974. At that time, it was fairly humble in size and scope, with only three members of staff, one of whom was the regional secretary and chief executive, then the other was an administrative secretary, and one support staff. But with the support and goodwill the organization has enjoyed over the years, we have grown in size and scope, and now have 54 full-time members of staff, and our scope has expanded to include and encompass virtually all aspects of health and health challenges in the region. Your Excellency, we have noted that the challenges that informed the formation of this organization 50 years ago remain largely the same. They may have changed, they may be disguising themselves, but they remain largely the same. In addition, we are grappling with the new entrants to the health challenges that we deal with, including the non-communicable diseases and injuries which are posing a great risk to our populations. And Your Excellency, as you are aware, health is wealth, And if we don't handle the wealth of our people, then the human capacity development will not be realized. I shall now briefly, with your permission, Your Excellency, highlight a few of the areas that ECSA Health Community has been engaged in over the 50 years. Obviously, it will be merely a snapshot. It will not be comprehensive. That comprehensive story will be told in a different form when we document everything. But we have been, right from the outset, interested in issues of the health workforce. And we have, from the humble beginnings, when in the 70s, the interventions tended to be of a short-term basis, facilitating exchange of faculty and specialists between countries, to short-term trainings, that is, for training outside the region. We have taken on this agenda more robustly, and presently are very proud to have a number of specialist training colleges that are helping us tackle the skill gap among our specialists. We are training surgeons, we are training anesthesiologists, ophthalmologists, physicians, pathologists, obstetricians, and gynecologists, to mention but a few. And our oldest college, the College of Nursing and Midwifery, has recently undertaken to train our nurses and midwives in a number of special areas, including critical care, chronic disease management, midwifery, and neonatal, perioperative, and anesthetic care. So, as part of our contribution to the health and well-being of our peoples. In the meantime, there are various training interventions we continue to be a part of in terms to upskill the existing workforce. We have been mindful of the poor nutritional status of our region, and among the interventions we have participated or contributed to has been the development of harmonized food fortification standards that have been adopted by the two sister regional organizations, the East African Community and the Southern African Development Community. On maternal and child health, as you are aware, Your Excellency, our region sits with very unfavorable indices in maternal ill health and maternal mortality. We are also losing many of our population in childhood and infancy. So we have undertaken a number of things, and one of the most successful ones I wish to highlight for you, Your Excellency, this morning is our contribution in skilling the frontline health workers in the active management of the third stage of labor. If not managed properly, this is when many of our mothers die through bleeding immediately after birth, the postpartum hemorrhage. And I'm happy to note that in those areas, in those facilities where the people were trained and retained, there was considerable reduction in maternal mortality on account of postpartum hemorrhage. We have also had a focus on gender-based violence and child sexual abuse, and more recently on the whole area of violence against children. In our involvement in these areas, we developed a prototype policy that was subsequently adopted or adapted by the member states. This is a policy for the management of gender-based violence, among the survivors. We also developed clinical guidelines for the screening and treatment of survivors of child sexual abuse, which were also adopted by the countries. More recently, Your Excellency, a lot of our efforts have been focused on the area of re-emerging conditions, or emerging re-emerging conditions and public health emergencies. I need not belabor the point. We are at the epicenter of very many disease outbreaks. And my brother from WHO will tell you that every year the continent experiences anywhere up to 800 outbreaks that are notifiable. So we have tried to contribute to the efforts in managing these challenges. And these efforts have included coordination of cross-border surveillance and outbreak detection and response mechanisms, the more to strengthen the region to manage the conditions collaboratively. We have contributed and continue contributing to improving the diagnostic capacity within our public health systems, because that is the first line in our response. If we don't understand what the issue is, we may not target it properly. One of the more targeted interventions in this aspect has been the strengthening of our national TB TB reference laboratory systems across the region, partly with the support from the Global Fund. And we have, on occasion, and more recently, even with the United Republic of Tanzania, worked with and supported member states in the conduct of the WHO joint external evaluation exercises. We are undertaking some work with some of our collaborators here to improve the capacities of our relevant departments in the sector to apply health economics analysis to the health sector. And in addition, we have previously conducted national health accounts, the ultimate being to ensure rational allocation of resources within the health sector towards efficiency gains. Knowledge management is an area that we have been at for quite a while. And yesterday we concluded the 14th Best Practices Forum, Your Excellency. And this is for us the premier knowledge management event or platform, because we bring together policymakers, the senior government officials. We bring together the researchers. We bring together heads of tertiary institutions in health, and we bring together the non-state actors, civil society, and non-government organizations in an open forum where they can discuss and tease out solutions to problems on the basis of evidence that will be presented or will have been presented by the scientists. So that is one of the ways we are contributing to knowledge management, by bridging the gap between evidence and policy formulation. But we have also set up a knowledge hub and repository where we hope to capture most of the research output from our region and ensure that it doesn't get lost for the next generation of researchers in our region. ECSA Health Community has been involved in seeking solutions to the gaps in the leadership and management capacities within our ministries. And to that end, we developed some light courses of an executive nature that we took the ministers through on the sidelines of some of our health ministers' conferences in leadership and management, based on the demand from the ministers themselves. And I have mentioned elsewhere that one of the issues in this regard is the fact that there tends to be high turnover of ministers of health, and not all ministers of health have a health background. So when they get into a highly technical sector, a little bit of peer learning from others was found helpful. So that was the mode that we utilized. But increasingly, we have been focusing on skills in global health diplomacy to enable our countries and our country delegations to get to the table for negotiations or discussions fully equipped with the relevant skills. And looking around the room, I see many of you were at the recent World Health Assembly, and you realized the kind of rigor that some of the items for discussion required. So that is an area that we are delving into in combination, in partnership with some of the organizations represented in the room this morning. And talking about partnerships, Your Excellency, ECSA Health Community has over the years forged and sustained a number of partnerships, which in addition to the resources that we receive from you, our member states, have enabled us to do whatever we have been able to do over the last 50 years. On behalf of my colleagues, I wish to register our sincere appreciation to all our partners for the support over the past 50 years. And to paraphrase Oliver Twist of old, please partners, we want some more. A journey of 50 years cannot have been without any challenges, Your Excellency. I will cite just 2 or 3 so that I don't spoil the flavor of my submission this morning. But we have a relatively low resource base, and yet the demand for support from the member states is huge. So we have often not done all we could have done on account of lack of funding. The other one is an issue that if I were the type not to sleep, would keep me awake at night, which is the fact that for more than 15 years, since the government of the United Republic of Tanzania generously donated land for us just outside Arusha, we have not been able to develop that site. Again, it is for the same reason of lack of funding. But I'm sure that in the next 50 years, by the time of the century celebrations, with support from the member states and the partners, this will have been done. The development will have happened. The third and last challenge I wish to highlight, Your Excellency, relates to the training that I talked about. The colleges we have established with support from our ministers find themselves on occasion encumbered by delays in registration, recognition, and accreditation of their offerings. And in some instances, the graduates from some of the colleges face difficulties in being absorbed within the health sector within the countries. That then makes it very difficult for the colleges that are offering a lot of time, effort, and expertise to continue doing this. So that is a challenge that requires intervention from as high the seat of power as possible so that we unlock that. But as we look ahead in the next 50 years, Your Excellency, I'm highly optimistic that ECSA Health Community will build upon and consolidate the successes and gains over the last 50 years and benefit from lessons therefrom as well to ensure continued contribution to the tackling of the health challenges in the region. In the increasingly globalized world where diseases know no borders, there is need for regional approaches to tackle many of the issues that bedevil us. Hence, a mechanism such as this that has earned its pride of place among the players in the health sector ought to continue along that journey. With the high burden of disease I have already touched upon and the diminishing resources allocated to health, inevitably due to competing interests, with the ever-present threat of climate change. And I'm looking at the delegation from Mauritius, and I'm reminded that for them, global warming is an existential threat because as the water levels rise, there is a possibility that we may not have Mauritius with us anymore. But we are hoping that some intervention will happen and will stem the global warming, and 100 years from today, the Mauritius will still be Mauritius where it is. That is our hope. So as I look to the future, I said I'm confident that we will continue as we have been. And I know that when the history of ECSA Health Community is told, posterity will note with appreciation the indelible mark all of you, through your various contributions, have made to the development of the organization in the past 50 years. Your Excellency, may I then, on behalf of my colleagues at your Secretariat, thank you, Your Excellency, for gracing this occasion. We appreciate the importance that the United Republic of Tanzania attaches to this organization, not only from the gesture that Dr. Ali Hassan Mwinyi made in attracting the organization to the United Republic of Tanzania, but for looking after us. You babied us, you saw us begin to walk, stumble, and finally we started walking. And like good parents, you let us walk when we could and put us in line when we couldn't. So we are most grateful to the United Republic of Tanzania, the government and the people for the hospitality over the last 50 years. And we know that the next years will be even much better. I also wish to thank you, honorable ministers and your senior officials in all our member states for the support that we continue to enjoy from all of you. I similarly want to thank all our partners who have put their faith and trust in us in various ways over the last 50 years and ensured that we walk this journey together. I wish to thank the fourth estate because they have been a part of our journey and they helped us tell our story in fora where we may not have been. And to everybody that is graced this occasion, to one and all, thank you very much.
Thank you, Professor. Your Excellency, the Vice President of Tanzania, ladies and gentlemen, 50 years is not a joke. It's really a remarkable point that they have made in leadership, excellency, in regional health collaboration. May I humbly ask you to have 5 good big claps for ECSA-HC, everyone representing a decade in a count of 3. 1, 2, 3, let's be going. That's beautiful. You can mix up the rest, yeah? Congratulations, ECSA-HC and the member states. This is really remarkable. Your Excellency, the Vice President, may I now welcome on stage the Dr. Ambrose Talisuna, who will give us the remarks by WHO Afro. Welcome.
Your Excellency, the Vice President, United Republic of Tanzania, the Honorable Minister of Health, United Republic of Tanzania, Honorable Ministers from the member states of ECSA or delegates representing ECSA, the Regional Commissioner for Arusha, all members on the high table, the Director General of ECSA Health Community, health professional associations within the ECSA, partners, the media, distinguished colleagues, ladies and gentlemen. Good morning and congratulations on this Golden Jubilee. As you heard, my name is Ambrose Talisuna. I'm Senior Advisor Programs, Health Advisor Programs at the WHO Liaison Office with the African Union and the United Nations Commission for Africa based in Addis Ababa. But this morning, I'm pleased to be here with you as you celebrate this Golden Jubilee and also to read a statement from my Regional Director, Dr. Mashidiso Moeti, who is the Regional Director for WHO Afro. She would have loved to be here, but due to competing obligations, she's not here and she sends her apologies, Your Excellency. Unfortunately, I'm reading her statement after the talk of Professor Joshua Dambisha. But I'm reassured because one time, the founding father of this country, the great leader, Mwalimu Julius Kambarage Nyerere once said, do not fear to speak after others have spoken because 1, you might address 5% of the subject they didn't touch. And 2, you might reach 1% of the audience that they didn't reach. So as I read the statement from the RD, you have to listen because you don't know whether I will address the 5% that Dr. Dambisha didn't address, and you don't know whether you're 1% of the audience that he didn't reach. So this is the statement. Your Excellency, the Vice President, Honorable Ministers, in the wake of the COVID-19 pandemic, there is renewed understanding from political leaders to the people they serve of the centrality of health and the well-being of socioeconomic development. We are aware that the health-related sustainable development goals are badly off track. But now is opportunity for us as international and regional stakeholders to renew our commitments to get on track on the SDGs. The post-COVID-19 period constitutes a unique opportunity for us to advance health, equity, and get our SDGs back on track. And realizing this ambition requires a common goal at the international level, at the regional level, and the sub-regional level. We require a common agenda. At the recent World Health Assembly, you as the member states endorsed our WHO General 14th Program of Work. And this program of work is really underpinned on certain critical pieces that we're referring to as we need to promote health. We need to provide health. And we need to protect health. But for us to do that, we need to power health through digitization and innovation. But we also need to partner for health. And we need strategic partnerships to achieve that. So as we celebrate ECSA Golden Jubilee, I hope that we will have that at the back of our mind to promote health, to provide health, and to protect health. Your Excellency, distinguished delegates, for us to promote health, we need to respond to climate change. This is an escalating health threat in the 21st century. We need to address the determinants and the root causes of health in key policies across sectors, not only in the health sector. We need health policies in the agriculture sector. We need health policies in the transport sector. In every sector, real multi-sectoral collaboration, not lip service multi-sectoral collaboration. Distinguished delegates, to provide health, we need to advance primary health care and have an essential healthcare system for universal health coverage. But we need also to improve service coverage and financial risk protection. At the moment, out-of-pocket expenditure is really challenging our populations, and we need to be addressing that. And finally, for us to protect health, we need to prevent, mitigate, and prepare for health emergencies that my brother, Dr. Dambisha, has been talking about. Tanzania has been a lead in this area. Tanzania was the first country in 2016 to conduct a joint external evaluation of the international health regulation, and subsequently to develop the National Action Plan for Health Security. And we would like to congratulate Tanzania for that leadership. Tanzania is actually now the second country to do the second wave of joint external evaluations after Syria. At the recent International World Health Assembly, there were amendments to the international health regulations. Your Excellency, we appeal to you that Tanzania should continue to lead by domesticating these international health regulations. We also appeal to you that Tanzania should continue to lead by lobbying for the pandemic agreement. There's some misinformation that is going on about the pandemic agreement, but we've realized from COVID that there are certain things that are not addressed by the international health regulations. Things around technology transfer, things around having regional and local manufacturing, so that we are not shortchanged the way we were shortchanged during COVID in terms of access to vaccines, access to diagnostics. So we hope that Tanzania will continue having this leadership. As I conclude, Your Excellency, COVID-19 pandemic has showed us that, and Ebola before that, has showed that the health systems that we use to respond to emergencies are the same health systems that we use for routine services. And once they are not resilient, then any emergency will disrupt the achievement of health services. So we really appeal to countries and all member states here to look at resilient health systems that can promote health, can provide health, and can protect health. We hope to continue working with ECSA in the areas of workforce development, especially community health workers. COVID has showed us that we need a minimum staffing norms across levels. At the primary healthcare facility, at the second level facility. And so member states need to define their minimum staffing norms so that we can be able to deliver services even in the event that we have shock events. In closing, we really thank you, ECSA health community, and the Republic of Tanzania for having invited WHO to participate in the best practice forum that ended yesterday. The key issues that were discussed at that forum are pertinent, and we commend you for this. Finally, I want to thank you and congratulate you for this 50th anniversary. Thank you very much, Dr. Moet.
Thank you very much, Dr. Ambrose Suna, for the remarks. Your Excellency, the Vice President of United Republic of Tanzania, the Buddha believed that to keep the body in good health is a duty. Otherwise, we shall not be able to keep our mind strong and clear. So when you talk about health, we talk about both our bodies and our mind. Your Excellency, allow me now to welcome to the podium Dr. Sultan Matendechero, who will give out the remarks by the chairperson of the Health Ministers Conference, representing Honorable Susan Nakumicha. Doctor, welcome.
Your Excellency, Dr. Philip Isdori Mpango, the Vice President of the United Republic of Tanzania, Honorable Minister for Health for the United Republic of Tanzania, Ms. Umi Mwalimu, Honorable Ministers from the ECSA Health Community, Arusha District Commissioner, Honorable Emanuela Kaganda, representing the Regional Commissioner, permanent and principal secretaries from the ECSA member states, Director General of the ECSA Health Community, Professor Yosua Dambisia, distinguished members of the Directors Joint Consultative Committee, senior government officials from the member states, and cooperating partners, members of the Fourth Estate, distinguished guests, ladies and gentlemen. First of all, allow me to present the apologies of our Honorable Cabinet Secretary, who is also the chairperson of the ECSA Health Community, Honorable Susan Nakumicha, who was to be with us here this morning, but due to last-minute exigencies of duty, was not able to join us, but expects to join us later today. It is with immense gratitude and honor that I stand before you today to extend heartfelt thanks to you, our esteemed guest of honor, and the government and people of the United Republic of Tanzania for being magnificent hosts of the ECSA Health Community. As we mark this momentous occasion in the history of our organization, it would be remiss of me not to recognize and applaud our hosts who ensured that the Secretariat operates in a conducive environment for the past 50 years in your beautiful city of Arusha, thus enabling our organization to grow into what it is today. I wish to acknowledge the dedication, hard work, and innovation that have brought us to this remarkable achievement. Together, we have reached a significant milestone that reflects our collective commitment to the well-being and health of our citizens. Your Excellency, I can confirm to you that as ministers charged with the responsibility of setting policy in the region, we have always ensured that every decision made is in the best interest of the population in the region. Through the resolutions we previously passed as ministers, we have witnessed a growth in regional collaboration with numerous cross-border interventions being implemented by the Secretariat. Your Excellency, this milestone we are celebrating today is also a testament to the unwavering efforts of our healthcare professionals, researchers, administrators, and support staff who work tirelessly day and night. It is their passion, expertise, and compassion that have transformed challenges into opportunities and setbacks into successes. We celebrate not only the numbers and statistics, but also the lives that have been positively impacted by our healthcare services. Each milestone reached represents improved access to quality healthcare, advancements in medical research, and enhanced community health initiatives. Today, we also extend our heartfelt appreciation to our partners and stakeholders who have collaborated with us on this journey. Your support and collaboration have been instrumental in achieving this milestone, and we look forward to continuing our partnership in furthering our shared goals. As we celebrate this achievement, let us reaffirm our commitment to providing equitable, accessible, and compassionate healthcare for all. Let us continue to innovate, collaborate, and strive for excellence in every aspect of our healthcare system. Together, we have laid a foundation for even greater accomplishments in the future. Let this milestone be a reminder of what we can achieve when we work together with determination, compassion, and a shared vision for a healthier, happier community of nations. To everyone who has contributed to this milestone, your dedication and hard work inspire us all to reinforce our belief in the transformative power of healthcare. We pledge to continue working tirelessly under the guidance of our respective governments in order to achieve our shared goals and aspirations. May I once again thank you, Your Excellency, honorable ministers, ladies and gentlemen, for working together towards achieving this milestone. Let us continue marching forward on the path of progress and prosperity. Long live Tanzania, long live the ECSA health community. Signed, Honorable Nahumicha Susan Wafula, Cabinet Secretary for Health and Chairperson of the ECSA health community. Thank you. Ngiyabonga, asanteni sana.
Yabonga Kikulu. Another Kakulu. Okay. Another round of applause to Dr. Thank you so much, Your Excellency, Vice President. For now, with the interest of time, we had to have an entertainment now, but let me now welcome one of the greatest leaders we have here, proudly the Minister of Health, Tanzania, who will now give us remarks and later on welcome Your Excellency to deliver your speech. Honorable Umi Mwalimu, welcome.
Your Excellency, Dr. Philip Isdori Mpango, Vice President of the United Republic of Tanzania, Honorable Ministers of Health from ECSA Health Community Member States, representative of Arusha Regional Commissioner, Madam District Commissioner, Excellencies, ladies and gentlemen, habari za asubuhi. Good morning. Allow me to say that the United Republic of Tanzania is greatly honored and privileged by your presence at this important landmark event, despite your busy schedule to celebrate Golden Jubilee of our community, the East, Central, and Southern Africa Health Community. The presence of you, Your Excellency, the Vice President of the United Republic of Tanzania, dear colleagues, honorable ministers, senior officials, and development partners is a clear indication and testimony of the immense support of not only to this conference, but to the ECSA and what it stands for. The Director General, Professor Yosua Dambisia, has elaborated what is ECSA, where it came from, what are the achievements, what are the challenges, and what is the future of ECSA. Your Excellency, allow me to say that ECSA is still relevant to promote and foster regional cooperation in health among member states in East, Central, and Southern Africa. I remember 4 or 5 years ago, we had a discussion within the member states whether or not to keep ECSA, taking into consideration that we have a very vibrant and strong East African community for Kenya, Tanzania, and Uganda. And for Southern African community, we have SADC for Zimbabwe, Zambia, Malawi, Mauritius, Lesotho, Eswatini, and Tanzania. We had a very big discussion, but then we agreed that we still need to keep ECSA, despite having SADC and EAC, where health remains top priority agenda for the region. So allow me, the Vice President, to say that ECSA remains relevant. We will continue to work together as health community in this region, and we are committed to mobilize other countries to join the community. I remember Botswana had left out, but we will work with the Secretariat to mobilize other countries to join this community, because it is also very technical. The EAC, the SADC, they deal with both policy and technical issues as far as the health sector is concerned. Your Excellency, the Vice President of Tanzania, the enormous task of improving health and well-being of our people remains to be the responsibility of all member states. I therefore urge my fellow ministers to join hands in sustaining gains and redouble our efforts towards improving the quality of life for all people in the region. Our wish is to see ECSA, health community member states, to be counted among those that contribute significantly to attaining sustainable development goals and the achievement of universal health coverage. I must bring to your attention that majority of these countries, UHC services coverage index is below 50, which is relatively low as compared to countries in other regions. However, with your leadership, guidance, and ongoing investment, we are sure that we will improve and surpass the set targets. Your Excellency,
As ministers of health under the ECSA health community, we pride ourselves in celebrating this momentous occasion with you today. We are grateful to our respective government for the unwavering support and prioritization of the health sector despite the competing national priorities. Over the years, as ministers of health, we have been passing numbers of resolutions that were meant to guide the implementation of health policies and interventions with the intention to improve health outcomes and well-being for the population in our region. I'm pleased to mention that we managed to implement most of the resolutions which contributed to the reduction of morbidity and mortality in our region. However, a lot remains to be done. I'm optimistic that with your leadership and guidance and the support from our collaborating partners, we shall manage to redouble our efforts towards achieving health for all. Your Excellencies, while we have been struggling with communicable diseases, for example, malaria, tuberculosis, HIV/AIDS, cholera, we do also see an increasing number of cases of non-communicable diseases in our respective countries, especially cancer, hypertension, and diabetes. Of course, as the performing group was the presenting, we are also struggling right now in our respective countries to fight antimicrobial resistance, which is partly contributed by irrational use of medicine. That's why in Tanzania, we have decided to come up with a nationwide campaign on Holela Holela Itakukosti, basically to combat irrational use of medicine, because this is also now a new challenge for the health sector in our respective country. Your Excellencies, therefore, we'll use this conference to revisit our important declarations adopted by our heads of state and government in the different platforms so that we can further improve the health and well-being of our people in the region. Your Excellency, before I conclude my remarks, kindly allow me to recognize a few among other distinct efforts shown by ECSA health community in Tanzania and in the region, including coordination of various interventions to strengthen the capacity and capability of countries' public health to prepare, detect, respond timely and effectively to public health threats. Through World Bank-supported project, ECSA health community has been providing technical support to the region, which elevated a window of opportunities for the countries to work together through knowledge exchange, experience sharing. Your Excellency, before I invite you to the podium, allow me to take this opportunity to introduce our very own Dr. Faustin Ndungulile, who is our candidate, Tanzanian candidate for the post of WHO Director General for Africa region. He is a medical doctor by profession, but also a public health specialist. He has all the credentials to be the Director General of the WHO Afro. So I kindly request honorable ministers for your support to Tanzanian candidate. And I'm very pleased, Your Excellency, to say that we have already been endorsed by 16 SADC member states. So we already have 16 votes from SADC countries. We are looking for 47 members divided by 2. I'm campaigning also for, because I'm the campaigning manager. 47 divided by 2 is 24. So we have 16 votes already. So we look forward to working with colleagues, Kenya, Uganda, those who are not members of the SADC and other. I'm sure you are going to support our candidate. And of course, maybe we'll give him later in the evening to say something about what his strategy, what is his vision for Africa. Mheshimiwa Makamu wa Rais, nilichomeka tu. This was not supposed to be part of my speech. Because I'm the campaigning manager, so I have to make sure my candidates actually So, Honorable Minister, thank you very much for attending this meeting. We are going to have our closed meeting this afternoon under the chairmanship of Kenya. So we'll be able to discuss other issues, including the need for undertaking an institutional assessment of ECSA after 50 years since its establishment. With these few remarks, I feel honored to invite you, Honorable the Vice President of the United Republic of Tanzania, to deliver your speech to this congregation of East, Central, and Southern Africa Health Member States. Karibu sana, Mheshimiwa Makamu wa Rais. The audience is now ready.
Well, I've seen the head of delegation from Malawi, and I was in Lilongwe on Sunday to bid farewell to a renowned son of Africa, the former Vice President of the Republic of Malawi, Right Honorable Saulos Klaus Chilima, who passed on through a terrible aircraft accident on the 10th. But yesterday also, when I was coming to open this celebration, a senior public official, the regional administrative secretary of a neighboring region, Kilimanjaro region, again passed on through a terrible road accident very close to Kilimanjaro International Airport. So please, let's spend at least a minute to remember the fallen sons of our continent. May their souls rest in eternal peace. Please sit down. Thank you. Honorable Umi Mwalimu, Member of Parliament, Minister of Health, United Republic of Tanzania, Honorable Ministers of Health from East, Central, and Southern Africa Health Community, as well as heads of delegations, Honorable Emanuela Tatifikolo Kaganda, representing the Regional Commissioner Arusha, Professor Yosua Dambisia, Director General of ECSA Health Community, Dr. Sultan, your other name is very long. Cooperating partners, senior government officials from our region, members of the media fraternity, distinguished delegates, ladies and gentlemen, good morning. Honorable ministers and distinguished delegates, the excellent remarks by the preceding speakers have actually preempted what I was going to speak. So I thought I should say welcome and then disappear from the podium. But the representative from the WHO, I think, made an interesting remark. So maybe my speech would still deliver the 1% or so. Well, I'm really honored to take part in this auspicious occasion to celebrate the 50th anniversary of the East, Central, and Southern Africa Health. On behalf of Her Excellency, Dr. Samia Suluhu Hassan, President of the United Republic of Tanzania, I wish to extend a proudly Tanzanian welcome to all our guests. Karibuni sana. Honorable ministers and distinguished delegates, as it is well known, health challenges are inevitably cross-border. You heard the Director General of ECSA speak eloquently about this. And it was for this reason that early on, our peers realized that we need to tackle health challenges collectively as a region. And this is what led to the establishment of ECSA in 1974. And as again we have been told, significant milestones have been covered in the last 50 years. And ECSA has played a very important role in addressing health challenges in pursuit of securing health security in our region. Through partnerships with other institutions, the ECSA health community has extended its reach to other non-member states, I'm told, including Botswana, Burundi, Cameroon, Eritrea, Gabon, Liberia, Mozambique, Namibia, Rwanda, Seychelles, South Sudan, and Somalia. And as a result of the significant milestones covered so far, I think it is worth celebrating this Golden Jubilee of ECSA health community and look forward to a brighter future. Thus, it gives me great satisfaction that Tanzania has been the host of the ECSA health community since it was established. I also wish to express the commitment of the government of the United Republic of Tanzania to continue hosting and supporting the ECSA Health Community Secretariat headquarters based here in Arusha. Honorable ministers and distinguished delegates, the performance of the health systems in ECSA health community member states in the past 50 years has been characterized by good performance in some aspects and unsatisfactory outcomes in others. And we should therefore aim to sustain the good performance while exploring ways to improve upon areas where performance has been weak. And in view of this, the ECSA health community ought to strengthen its work to raise the standard of health for the people of our region by promoting efficiency of health services through cooperation, collaborative research, and policy development. Regional platforms such as those offered by the ECSA health community provide us with an opportunity to harness and leverage our successes, experiences, and collective wisdom towards addressing the common health challenges faced by member states. And I, for one, believe that universal health coverage is a cornerstone for achieving sustainable development and should be a key focus of our regional health strategies. Honorable ministers and distinguished delegates, while we remain committed to the global health security agenda, we should take cognizance of our region's vulnerability to public health threats posed by communicable and non-communicable diseases, as well as pandemics and climate change. The ever-increasing cross-border movement of people and animals makes control of communicable diseases even more challenging. The effects of climate change on health also pose a significant threat to public health due to an increase in vector and waterborne diseases. Systems to better prepare for and respond to climate change-related health issues. The region continues to grapple with the burden of tuberculosis at a time when antimicrobial resistance is rapidly setting in. We have in recent years witnessed a gradual increase in the prevalence of drug-resistant strains of TB, malaria, and other diseases. We have likewise witnessed sporadic outbreaks of viral hemorrhagic fevers, Ebola, yellow fever, Rift Valley fever, dengue, Marburg, and cholera, which have been chronic in some of our member states. I am of the view that there is great need to strengthen our health systems at all levels, but with more focus on primary health care so as to effectively manage public health threats. I am aware that the region has already started investing in cross-border disease intelligence and surveillance systems, joint outbreak investigations, and response mechanisms. I have also been made to understand that investments made in strengthening our region's capacity to diagnose many diseases of public health concern include TB, acute respiratory tract infections, and diarrhea. These investments have already proved to be profitable, as evidenced by swift response to detection and containment of such disease outbreaks. However, there is still need to further strengthen emergency health preparedness, response, resilience, and recovery in order to mitigate the impact of public health emergencies and disasters in our region. Honorable ministers and distinguished delegates, currently, Africa shoulders over 20% of the global burden of diseases. As such, I wish to reiterate that ECSA, as well as the challenges of climate change and pandemics. But besides communicable diseases, the region is challenged by a rapid growth of non-communicable diseases, and particularly diabetes, cardiovascular diseases that were once regarded as diseases of the affluent. While the health sector is grappling with the management of those living with non-communicable diseases, their prevention requires actions that involve sectors beyond health. So promotion of healthy diets and regular physical exercises must be a preoccupation of all across the spectrum. As we review progress made in the past 50 years of the ECSA health community, let us also take cognizance of the challenges and gaps while harnessing and leveraging our concerted efforts in addressing them. And I'm glad to note that the conference has allotted time to discuss these issues in detail. Honorable ministers and distinguished delegates, our strive to attain universal health coverage and SDG 3 has thus far not delivered results to the desired level. While we take note of some progress made, mileage covered with respect to maternal, newborn, and child health is less promising. The health indicators in this regard compare less favorably with those of other regions of the world, and our region is off track in achieving SDG 3. As we approach the 2030 finishing line, we should remain focused on delivering better health outcomes for women, adolescents, and children, particularly on ways of ensuring that health services to these groups are more accessible and user-friendly. Honorable ministers and distinguished delegates, in addressing the health challenges before us, I think our planning frameworks also need, among others, to focus on longer-term goals that will lead to healthier and productive lives of our people. And in particular, I wish to emphasize the pivotal role of good governance in addressing health sector challenges. I believe it is key to the development of the health systems that are responsive to the needs of the population by ensuring that the health systems are well financed and provide safety nets to the most vulnerable segments of our population. Honorable ministers and distinguished delegates, allow me to propose 3 issues for your consideration in your subsequent discourse. And first, I think it's the need for robust health research that can lead to improved disease diagnosis, more effective treatment options, and overall strengthening of healthcare systems. Due to massive epidemiological transition that is taking place globally, research is an indispensable component of improving health outcomes. And in the next 50 years, I urge ECSA health community member states to invest significantly in biomedical, clinical, social, cultural, environmental, and pollution health research. Second, I encourage governments in the ECSA region to translate into action their commitments to scale up budgets for health, particularly essential medical products and technologies, as well as health information systems for attainment of the highest standards of physical, mental, and social well-being of our people. I wish to reassure you that the government of the United Republic of Tanzania will remain steadfast in fulfilling its obligations towards the ECSA health community. And I also urge all our development partners to continue supporting the ECSA health community priority agenda. But also for the ECSA health community, please forge more partners in support of our region. Thirdly, I urge the ECSA health community to scale up efforts to address the stubborn health challenges that face our region. And some of them have already been mentioned, including poor nutrition, gender-based violence, and sexual abuse. Before I conclude my remarks, let me also use this platform and then follow the footsteps of the campaign manager to drum up for the candidature of Honorable Dr. Faustin Engelbert Ndugulile, who has been endorsed by the government of the United Republic of Tanzania to vie for the position of Regional Director of WHO Africa. I had the pleasure of working with Honorable Dr. Ndugulile in cabinet and can attest to his outstanding capabilities. And as you heard, Dr. Ndugulile has formal support of the Southern African Development Community, SADC, and most East African countries. And the government of Tanzania is therefore appealing to you to support his candidature. Lastly, allow me to end my remarks by congratulating and wishing the ECSA health community great success in the next 50 years. Thank you.
A big round of applause for the Vice President. Thank you so much. Thank you so much, Your Excellency, the Vice President of Tanzania, for delivering the speech. That was very immense, educative, and with a lot of information. For now, Your Excellency, with your permission, allow us now to let the recognition of member states' commitment to the health community over the past 50 years, which will be marked by your presence to hand over some awards that have been prepared. So for now, we'll start with the first one, which will go to the member states, and the ministers will be coming over to pick them up. I hope the awards are ready and they'll be given accordingly. So to start with, may I welcome, with your permission, allow me to welcome Honorable Mduduzi Matsebuta, Minister for Health from Kingdom of Eswatini. Yeah, may I now allow the high table to raise? Yes. Followed by Dr. Sultan Matendechero, Acting Deputy Director General, on behalf of Honorable Susan. The second to Kenya, Dr. Sultan will represent Honorable Susan, the Cabinet Secretary for Health. A round of applause for them. When you the next one to the Kingdom of Lesotho, Honorable Seipati Monyobi, Deputy Principal Secretary and the Head of Delegation. A round of applause for them. The next one is to the Republic of Malawi, Honorable Halima Daudi, Deputy Minister of Health. The next is to Mauritius, represented by Dr. Prithviraj Rampati, Director of Health Services and the Head of Delegation. And to Tanzania, Honorable Umi Mwalimu, the Minister of Health. The neighbor of the Republic of Uganda, Honorable Anifa Kawoya Bangirana, Minister of State Health. And to Republic of Zambia, Professor Eliot Kafumukache. For the next one, Your Excellency Vice President, for exemplary leadership, this award goes to the Director General, Professor Yoswa Dambisia. Doctor did the switching exactly at the very good time. The next one, Your Excellency, would like to humbly ask you to present the certificate of long-serving staff. We will start with Mrs. Mwambua Harry. Actually, she's still working. I'm told she has served for longest time, almost not even one reaches the years that she has been in the office. Is that so? All right, it's beautiful. The other two, Your Excellency, are retired, but they have had dedicated service for very long time. Mr. Julius Charles Lay. Retired, but not tired. And the last one before we go for group photo, Your Excellency, this one goes to Mr. Eric Shelukindo. She will receive that on behalf of Mr. Eric Shelukindo. Thank you. May I humbly ask the Hatbo now to get seated? Please get seated. Now, let me go through the group photo, calling one group of member state delegation, which will be either headed by the ministers or the heads of delegation. The first one will be from the Kingdom of Eswatini, followed by Republic of Kenya. Then we'll go to Kingdom of Lesotho, Republic of Malawi, Mauritius, Republic of Tanzania, and then United Republic of Tanzania, and then Republic of Uganda. After that, we go to I have seen some delegation from Zambia as well. And then lastly, to Zimbabwe. So for now, you'll be taking your way on here. And then as you leave, you'll be using the other little seat. So may I, Your Excellency, allow me now to call on the stage the member of state delegation from Kingdom of Eswatini. Delegation from Kingdom of Eswatini, headed by the Honorable Mduduzi Matsebula, Minister of Health. Unjani. The only language that I remember about Eswatini. The second one is the Republic of Kenya. The Republic of Kenya, headed by the Honor, Dr. Sultan is up there, so the others can join him. Brother from Kenya. He's taken out by the Kingdom of Eswatini. So as I say, you use these stairs on my left. Hakuna Matata, they say. Then the Kingdom of Lesotho, headed by Madam Seipati Monyobi, Deputy Principal Secretary and the head of delegation. Kingdom of Lesotho. Your Excellency, these people from Eswatini and the Lesotho, they almost speak the same language. So you say Unjani, they also understand that, as well as the people from South Africa. Allow me again, Your Excellency, to call the Republic of Malawi, headed by Honorable Halima Daudi, Deputy Minister of Health. The next one is from Mauritius, headed by Dr. Prithviraj Rampati, Director of Health Services and Head of Delegation. The next one is from Tanzania, Honorable Umi Mwalimu na mgombea wake yupo pale. Yes, the representatives, yes, the Chief Medical Officer. Chief Medical Officer and your team. The Minister wants to see you here. Take this side, take this way. Hizi picha bwana, kuna kauteuzi kakitoka, unaweza ukaitumia kuthibitisha I was there. Mchezo. Make sure the photographer catches your image closely. The next one is from the Republic of Zimbabwe, headed by Honorable Douglas Tendai Mombeshora, Minister for Health. Republic of Zimbabwe. After the member state delegation, Your Excellency, allow me now to call the presidents of colleges of ECSA. Yes? Oh, Uganda? Oh, Zambia, sorry. Zambia, please. So Uganda, and then Zambia, right? Okay, I forgot that. You may forgive me for that. Thank you. They say Ugandans are photogenic. May I now welcome on the stage, Excellency, the delegation from Zambia. When you post the pictures, don't forget to tell the people in the world you were in Tanzania, the land of Kilimanjaro. Yeah? Thank you very much. So now, Your Excellency, may you allow me to welcome on the stage the presidents of colleges of ECSA, the community, the presidents of colleges of ECSA Health Community. And the last picture, Your Excellency, may you allow me to call on the stage the Secretariat now. The Secretariat of ECSA, who have worked so hard to ensure this event comes to success. A round of applause for these guys. I have been with them in a week now, almost. They are working like mchwa. This is made. So here we can have two pictures. Let us try two, and if possible, three. If possible, three. Let us see if you see. Hizi picha jamani, ukitokelezea uko na makamu wa rais inabidi uonekane. So we need some groups which are manageable. Thank you. Use the other stairs to get down from the high table. Can we have the next group? Thank you. Another group, please. Great. I hope this is going to be the last group. And the last picture will be for collaborating and cooperating. The last one will be for collaborating and cooperating partners. Representatives, please. I think we can also have some groups here, manageable groups. Yes, you can take it away on your right side. Can you have the next one? Golden Jubilee celebration for the East, Central, and Southern Africa Health Community today, 19th June 2024. Ladies and gentlemen, may I humbly ask you to raise as the guest of honor will be taking his way out. Thank you so much. We're so grateful to you, the Vice President of the United Republic of Tanzania. Now, Thank you. Asante. Asante sana brass band ya chuo cha mafunzo ya kijeshi kwa kazi nzuri ya leo, tuongozwa na Captain Mpanda. May God bless you. I have a few announcements to make before we depart. The first one, there'll be a closing meetings of the ministers in the evening today from 4 p.m. And the second, lunch will be served from 12:30 this afternoon. And I think we also have, if you look at your program, we have part 2 of Golden Jubilee Celebration Gala Dinner, which is about to start tonight by 19 hours. Otherwise, my name is Ruben Dimbo, your facilitator. May God bless you all and see you some other times.